I'm Dr. Jay Pepose, Medical Director at Pepose Vision Institute. I have always made safety the priority here at the practice, whether it is the safety of patients, patient families, staff, or surgeons. Throughout this COVID-19 pandemic, dedicated doctors and staff at our institute have been caring for patients with urgent sight-threatening conditions and emergencies. Now that the stay-at-home order has been relaxed, we will be reopening our doors to treat patients with non-emergent conditions as well as resuming surgery. To move forward safely, we are strictly adhering to the guidelines issued by the CDC and the American Academy of Ophthalmology. Moreover, I am bringing to bear my scientific training as an immunologist and virologist to assure you the safest environment possible. To achieve this goal, we have made some noticeable structural and operational changes.
I am Dr. Mujtaba Kazi, Senior Cornea Specialist at Pepose Vision Institute. Let me walk you through some of the changes you will experience when you come for your appointment. One of the very first things you will notice is that your temperature will be taken at the front door, and you will be asked screening questions that help us determine your risk for coronavirus infection. We will require you to wear a mask in the building and to keep it on at all times. If you do not have a mask, you will be provided one and instructed on how to use it properly. In addition, we will disinfect your hands with sanitizer. We will also make sure that there is soap and disinfectant in the bathrooms, examination rooms, and other areas of the facility. We have eliminated all magazines, newspapers, coffee dispensers, and water fountains to avoid touching surfaces and congregating. We will not allow anyone except the patient to enter the building. Drivers and companions will be asked to remain in their cars where they can be contacted by phone when needed. We ask that drivers not leave the building grounds while you are at your appointment. If you are accompanying someone who is visually or physically impaired, you may bring them to the front desk for check-in if a staff member is unavailable to provide assistance. You would then return to your car and wait for a phone call. As always, service animals are allowed for patients in need.
My name is Dr. Nancy Holkamp, Director of the Retina Service at Pepose Vision Institute. We have thoughtfully made structural changes to our facility to promote everyone's safety. At front desk check-in and check-out areas, you will notice protective plastic barriers have been erected. Slit lamps and other equipment in examination and diagnostic rooms have also been fitted with protective plastic barriers. You will notice markings that indicate 6-foot intervals so that patients remain safely separated while checking in or out. Also, in waiting or dilating areas, chairs have been moved apart and or marked so that seating follows social distancing requirements. If we are running behind our intended schedule, you will receive a text message, or you may be asked to remain or return to your car, and will be notified when we can promptly see you without delay. Some patients with eye conditions, such as pink eye, may be cared for by telemedicine rather than an office visit. For new patients or surgery patients, our staff will work with you before your visit to fill out as much of the requisite information as possible via our patient portal or through the mail. Some types of paperwork, such as surgical consent forms, may still need to be signed in the office, but we are making every effort to minimize and consolidate these forms. We are doing everything we can to reinvent the waiting room experience to limit your exposure to the fewest number of staff and patients for the briefest time possible. We intend to spend a considerable amount of time before and after each patient to thoroughly disinfect all equipment and surfaces. All of our staff will be wearing masks and other protective equipment and will be disinfecting their hands before and after each patient. We have lightened our schedules and we will be seeing fewer patients each day. Nevertheless, it is not possible to plan ahead for unexpected emergencies or to know exactly how much time a specific patient may require. We are asking for your patience and cooperation if you are directed to a waiting area in a less crowded area of our building or back to your car to wait until we can safely prepare a room for your appointment or procedure. Please realize that we are doing this solely in consideration of your health and safety, as well as the health and safety of your family members. Please also know that we will be monitoring our staff daily by taking their temperature, testing their blood oxygenation, and asking screening questions. For their sake and ours, we want staff who are sick or exhibiting early symptoms to stay at home. They will not be allowed to come to work.
You may notice that even the appearance of some of the doctors has changed, as some of us have had to shave or trim beards to allow a full seal of a protective mask. All of us are making changes, big and small, to maintain the success that stay-at-home orders have had on reducing the spread of COVID-19. We know that vision services are essential and do not wish to defer your eye care any longer than necessary. At the same time, our number one priority is the health and safety of our patients, your families, and our staff. During this stressful time of getting back to life outside our homes, let us come together with a renewed sense of goodwill towards each other. Patience and vigilance are essential, even in the most trying situations. As we enter this new unknown together, we will be constantly reevaluating our safety measures and making improvements should we see a need. We value the trust that you put in us to care for you and your most precious sense, the gift of sight. At Pepose Vision Institute, our mission is to protect, preserve, and whenever possible, to enhance your vision. And we value your safety above all else.